So IVF is also known as test tube baby. The full form of IVF is in vitro fertilization, which means fertilization which is done outside the body or in the lab. So what we do in IVF is we give injections for 10 to 12 days to stimulate the ovaries to develop multiple eggs. So this is the first stage of IVF, ovarian stimulation. Second stage of IVF is where we take out the eggs outside the body by a procedure called ovum pickup. This is done under anesthesia with a transvaginal ultrasound guided probe. A needle goes next to the probe and we aspirate the follicles. Once the eggs are out, the third step of IVF is making the embryos in the lab. What we do is each egg is combined with one sperm and we check for fertilization next day. The fertilized eggs are then observed in the laboratory in optimal condition to see how many embryos are developed. So usually we wait till day 5 or day 6 where we get a blastocyst stage embryo. Once we have a blastocyst stage embryo, we can select one embryo or two embryos and put back inside the uterine cavity, which is the last step of IVF, which is embryo transfer. So embryo transfer can be done in the same cycle when it is called as fresh embryo transfer. Sometimes we may freeze the embryos and we plan the embryo transfer in the next cycle when it is called as frozen embryo transfer. So this is IVF.